Hi, hello. This is Varghese John once again. Welcome to my YouTube channel, and here we discuss all about infection prevention and control. If you like my videos, please share and subscribe. And we'll move towards today's topic, that is hand hygiene. Welcome. Few facts about our microorganisms or bugs. 2 to 10 million bacteria are present in between your fingertip and elbow. Damn hands spread 1,000 times more germs than dry hands. The number of germs on your fingertips doubles when you use a toilet. Germs can stay alive on your hands for up to 3 hours and more. There are as many germs under your rain as there are people in Europe. So, in fact, we are living on germs. Just move on. In our hands, there are two different kind of floras. The first one is resident floras. It usually live in the hair follicles and dead epithelium. Examples like coagulus negative staphylococci or micrococci. And other one is transient floras. Cannot multiply on skin, easily removed by mechanical means, and can spread one to another. Examples for transient floras are pseudomonas and other gram-negative bacilli or gram-negative rods. And somewhere in between these, staph aureus or beta hemolytic streptococci. Who laid the foundation for the concept of hand hygiene in hospitals? Edward Jenner, Joseph Lister, Louis Pasteur, or Florence Nightingale? I think you couldn't find the right answer because it is not mentioned here. The right answer is this man, whose name is Dr. Ignaz Philipp Semmelweis. And let's discuss how he found the hand hygiene can play a big role to prevent the spread of infections. When he was working in a general hospital of Vienna, he conducted a studies because during that period, the postpartum mortality rate was very huge, and he divided his entire clinic into two, and one clinic he handed over to the midwives and other to the doctors, and he observed and he found the doctors are directly coming from the mortuary rooms or the post-mortem rooms towards to the mother to examine for the PV examinations and all. And in the midwives rooms he observed the midwives are washing their hands in between for other purposes. So he implemented this hand washing. This was the first the hand hygiene facility we could have we had. And he finally found, and he just started his intervention, and he found the mortality rate among the doctor's clinic just came down as the nurses. So he found, yes, hand hygiene can play a big role in prevention of healthcare associated infection spread. That is how the hand hygiene came into the existence of healthcare facilities. And this is how the or microorganisms or the infection can spread from one to another. This patient is colonized. You can see the dots, which is germs, and this present all of the patients as well as the immediate surfaces. And one doctor or any healthcare worker just coming and just getting that germs from the patient when he do some procedure on them, and he could spread that to another patient B. So this is how this is getting transferred to one another. So another example, as we were discussing the previous slide, the patient was not only the colonized or the contaminated by the germs, but the surfaces also. This is a very good example. You can see this was a patient's bed of a patient which is at positive for vancomycin resistant enterococcus, and this X marked sites were positive for VRE on cultures. So it is it is it shows not only the patient and the patient's immediate surfaces also can be seen, because the healthcare workers is transferring the same germs from the patient to almost all the surfaces. There are five stages of transmission. The first stage, the germs will be present on a patient. Second, where the germs will transfer to the healthcare workers. And the third stage, it will remain on their hands if they are not doing the hand hygiene. Yes, the fifth one, it can transfer to any surfaces or to any persons. So we may think how for a small procedures also the microorganism can be spread or not. Yes, absolutely. For a few simple tasks I just mentioned here, pulling patients up in bed, yes, it can get the germs from the patient to your hand. Taking a blood pressure or pulse, touching a patient's hand, rolling patients over in bed, touching the patient's gown or bed sheets, everything, every simple procedure also can spread the germs from the patient to your hands. With a picture here which shows the culture plate showing growth of bacteria after 24 hours, a nurse placed on her hand on the plate. So this many bacteria you can see. This is a simple example how dirty your hand is. And most frequent sites of infection and their risk. Here we will be discussing the most common healthcare associated infections. 34% of healthcare associated infections is urinary tract related infection, like catheter associated UTIs. 13% will be because of ventilator associated infections, like ventilator associated pneumonias or ventilator associated tracheobronchitis and other events. 13% of all healthcare associated infections are related to procedure related infections such as surgical site infections, and 14% carries the blood infections like central associated bloodstream infections due to the central venous catheter uses. And why this all happens, only the main cause of this all healthcare associated infections are because of lack of hand hygiene. So the hand hygiene is very important. So to prevent this spread of infections from one patient to another, the WHO, the World Health Organization, just proposed the 5 moments of hand hygiene approach. So before touching a patient, you just want to do hand hygiene, and before doing any procedures, you just want to do, or after getting blood or body fluid exposure risk, you have to do, and after touching the patient, and immediately after touching the patient's surroundings, also you have to do. This is the 5 moments of hand hygiene, which is proposed by World Health Organization. In our hospital settings, there are different kind of hand hygiene facilities we'll be having plain soap and water and the microbial soap and water, like the iodine powder and hand scrub and all, and alcohol based hand rub. So which is the best hand hygiene method is best at killing the bacteria. So you may tell all of the above or any other answers, but the answer for this question is alcohol based hand rub is the best to killing the microorganisms, and we'll be discussing the other methods also in the next slides. So this slide is showing the best to explaining the previous slide. So when you look at the alcohol based hand rub, yes, it can kill 99.9 percentage of alcohol, means microorganisms, in your hand. But under microbial soap and water, or plain soap one, it couldn't reach uh, 90. So why we are having these two facilities like plain soap and water and antimicrobial soap? So the reason also we'll be discussing on the later slides. And among these three, also the hand hygiene methods sometimes causes the dryness of your skin also. So among these three, which is the least drying to your skin? So the answer also is alcohol-based hand rub. So alcohol-based hand rub is having some kind of emollients. When you are doing plain soap and water, hand wash, or any other hand washing facility, you can feel with the drying of your skins. So if you are, we discussed in previous slides, so alcohol based hand rub is the best method of hand hygiene. So if you are practicing the alcohol based hand rub instead of I mean hand washing, like a plain soap and water or the antimicrobial hand wash, you can save about 30 minutes in a shift actually. So for performing a hand washing, you could take about 40 to 60 seconds, but unfortunately the healthcare workers usually take less than or 10 seconds or 10 to 15 seconds. So the effectiveness also is a matter here. But when you want to do the alcohol based hand rub, it only needs about 20 to 30 seconds of rubbing. So for the effectiveness, yes, the alcohol based hand rub is the best. And the other kind of other one aspect, some people used to tell, like healthcare associated organisms like MRSA or MDROs commonly resistant to alcohol as they resist the antibiotics. So my answer for this question is I strongly disagree, because the WHO, they released, and in their sites also it is mentioned actually this is a kind of myth. So alcohol based hand rub is not having any resistance to any of the bugs. So as I mentioned in my previous slide, so if you use plain soap and water, yes, it is always good. When you use antimicrobial soap and water, it is better. So when you're doing alcohol based hand rub, yes, it is best. Why we are still using the other two facilities? The explanation is and down. Plain or antimicrobial soap and water better than alcohol based hand rub if your hands are visibly soiled. If your hands are visibly soiled, you cannot perform the alcohol based hand rub because the stain will remain on your hand. And in other situation is like for performing the hand hygiene for spore forming organisms like Clostridium difficile or anthrax, yes, you need to wash. Only thing, because alcohol is have poor activity against bacterial spores. So when you are encountering with spore forming organisms, yes, you must do hand washing, not hand rub. So when your hand is visibly soiled, you just want to perform hand wash. If your hands are visibly clean, perform alcohol based hand rub. For the effectiveness, the WHO, they proposed the few steps for hand hygiene. You can see a lot of videos in YouTube how to perform this hand washing technique or hand hygiene technique, and you can go through these are the steps actually. And some other thing, how you are getting contaminate your hands, like coughing on your hands or sneezing on your hands or using gloves instead of doing the hand hygiene. All these situations are still contaminating your hands. So what to do? Whenever you want to sneeze, you just please catch it by any tissue papers or handkerchief, bin it safely and kill it. This is the average hand hygiene compliances among 34 studies conducted. It ranges about 40%. So if any healthcare institution is having more than 40% of hand hygiene complaints, that means they are performing in a fair way. It's not very good, but it is fair. You can achieve at least of 70 or more. It is always good. How far you do, more good. Then, how and why these hand hygiene complaints are getting low in the healthcare settings? It is on two things. It is increasing the workloads or the shortage of staffs. So these two things will compromise to do the hand hygienes, but this is not at all recommended one. Another aspect about the hand hygiene is when you perform the hand hygiene, you can see there are different sites can be missed when you are doing the hand hygiene. So in this slide, it shows what are the most frequently missed places and less frequently missed places. So you can perform one UV analysis also to know which is your weaker part when you're doing the hand hygiene and which is your stronger part. And the other thing which will compromise the effectiveness of hand hygiene is the fingernails and artificial nails. It is not at all recommended in the healthcare areas, the patient care areas, and artificial nails are not recommended. And if your nails should be short enough to resist or not to encourage the microorganisms to live underneath of your fingernails. So always some of the doctors or some of the healthcare workers may think, I just want to perform some procedures, but I just want to protect myself, so I don't want to use the hand hygiene. I can use the gloves instead, but it is not recommended at all. So when the gloves can be used, so whenever you encounter with blood and body fluids, yes, you can use gloves. And this gloves should not be shared in between the patients, and don't share the same gloves for more procedures also. Do not wash and use the gloves. So from these slides, what we know, bugs are on our hands, on our body, everywhere. Bugs can be removed by doing the hand hygiene, effective hand hygiene. By what and how and when? So I'm just revising how the six other steps of hand hygiene proposed by WHO, when the 5 moments of hand hygiene proposed by WHO, and why? Because we should not spread the bugs. So we know all these kind of things. So taking bugs off our hands saves life. So we know all these things. Then, so what is the problem? Still we are having the spread of infections. The only problem is the healthcare worker don't gel or wash their hands. It's all about the teamwork. Everyone in the healthcare settings should encourage the hand hygiene and achieve the good hand hygiene compliance. Do hand hygiene and save lives. Thank you so much, and we'll meet you in the next video. Thank you so much once again.